have it as a recording that you can have and ask for. We will also post it on our website and then send around the slides as well. Here are some texting trends. So these are statistics that are compiled from Pew Internet Research, which is the most reputable as far as statistics about mobile phone usage. Americans under 55 now text more than they talk on the phone and email. And it's the GenY that are texting to the exclusion of phone calls and email. So you can try to call some GenYs and they won't pick up their phone. They'll let it go to voicemail. And the voicemail will pile up, and maybe it won't even be saved, and maybe they won't even listen to their voicemail. So texting is a powerful medium in getting at individuals who really aren't using their phone to make voice calls anymore. Over 70% of Americans would prefer to text over phone for live help. So just asking a quick question from an agency, getting help with where to go for social services, getting a referral for social services, just any kind of engagement that could be done through text, they would prefer to text it. Over 98% of texts are open in the first 5 minutes, which is a tremendous read rate, right? So by comparison, if you're do any Twitter or do tweets, 80% of all tweets are ignored. So when you talk about reach and engagement, there just isn't a more powerful medium. When people get text, it doesn't matter if it's from an agency, a social services agency. In fact, they might mark that or flag that as more important. But it doesn't matter. If they get a text, they open it up and read it. Over 100 million U.S. households no longer own a landline, which is an amazing statistic. What we found was that when people were approached by their mobile phone, or I'm sorry, their phone service, a lot of times it started to mix with what their mobile phone service was. And so in order to get more lines, or in order to get more data, or in order to get more, they would say, well, why don't you just turn off your landline? Are you using your landline? Well, will we, use it for this or that, or we get, well, why don't you turn that off and just use your mobile phone for all of that communication? And so a lot of households chose to do that. What they didn't realize was what they might be sacrificing as a result. There are certain numbers that you can call on landlines, 3-digit numbers like 211, that you can't do so through all of the mobile carriers and the mobile networks. But there's a lot of pros and cons to that. But what it did was it shifted all of the communication to the mobile phone, and so that became the center of the universe, right? We have clients that work with a lot of agencies. That work with a lot of individuals who, like for instance 211, who have people who are really destitute, and what they found is they will give up almost everything, all of their possessions, before they give up their mobile phone. And sometimes it's text that's the last thing that they've got that they can communicate with. So they don't have any voice minutes, but they have some text. 80% of all web browsing in the U.S. is happening on smartphones. 80% of all web browsing in the U.S. is happening on smartphones. That means that people are not using or don't have a home internet service. What they're doing instead is, and that's why there's so much cost associated, all of the cost is around data plans, right? How much data usage are you using? Because people are going home, and instead of having home internet, they're just browsing the web from their mobile phone. Contact centers pay on average 80 cents per text encounter. So this is we use contact center broadly, but this is any agency that has a public-facing, where they have encounters with clients and phone encounters, setting up appointments, things like that. On average, it's 80 cents per text encounter, whereas a call can cost as much as $20. So there's cost savings to be thinking about in terms of utilizing text or shifting some of these communications towards text. Individuals who grew up texting are now adults. And it's this group that is seeking human services and resources with the expectation that these services be accessible by text. So their texting agencies are trying to, at least. You would be amazed how many texts are going to phone numbers that can't accept them, right? Because people are thinking, well, I should just be able to text my WIC. Well, if they try to text some number that's not text enabled, that it doesn't accept text, then it's just going to get an error message. Studies on text behavior report that subjects prefer texting when dealing with emotional issues or asking for help. So sensitive subjects like social services, asking for help with financial or food assistance. Those are sensitive topics that people would prefer to share when they're able to do so through text. And these research projects have come out of Berkeley as well as University of Minnesota School of Epidemiology. So the messaging capacity that we're talking about here is live one-on-one texting for live help. So information referrals or providing help to people in a live way. Being able to converse from your computer workstation, and then the end user, the client, is texting from their mobile phone. So it's in a safe, you're on a safe, secure environment, and it's also allowing you to communicate at scale, right? And communicate across all of your clients and ensure that all of that information is being stored in a secure environment. Reminders, auto responses to keywords. So getting educational messages sent to you, or getting alerts about the WIC package or the WIC services changing. Letting people know about important things related to their benefits, right? Triages. So we're going to talk a little bit about triages as well after the share. But triages are just querying individuals in an automated way through text, having a survey or a post-encounter survey. Did you get the help that you needed? A reminder series, and this is what WICs use with regard to the peer counseling work. So an educational message track that goes out according to when somebody opts in and starts their service with you. And then we have prenatal educational tracks, postpartum educational tracks, and those can be easily assigned to clients. And then clients would be able to converse with peer counselors or converse with WIC specialists while they're getting those educational texts. And then creating ad hoc group messages, just being able to assemble groups based on whatever criteria, birthdays during a month, or their children and their birthdays, or whatever criteria you have, you can build little ad hoc groups and send those groups content. And then we're going to talk about appointment reminders by text, which is an incredibly important piece, and that's where we're going to shift gears and go to the share here. Just a minute. Okay, so the share is, we're excited to welcome Susan Lyle. She's the Director of Nutrition Services from WIC for Santa Barbara County Public Health Department. And she's going to share about their experiences using the service to provide appointment reminders, but it's a different breed of appointment reminders. It's important to understand this, and we're going to show a little demonstration afterwards on just how these appointment reminders work. But they're combining the automated side of sending appointment reminders with live help that's through text messaging as well, so that individuals who need to cancel or reschedule can just text back and then engage with a WIC staff and have a live conversation back and forth texting to change that appointment and reschedule. And it's amazing. You think, well, how is that? How does that work? And how is that going to be possible? We have limited time as it is, and how are we going to respond to all of those requests? When you add it all up, the amount of time that it saves, and Susan's going to share about this, it's incredible, because you're saving so much time with regard to chasing people down who maybe would never have picked up the phone to call the council and things like that. People also, when they get appointment reminders by text, their knee-jerk reaction is, I should be able to text back and engage and ask a question about it. What do I need to bring? Or do I need to bring my child? Or, I mean, anything that pops up, that channel would be open, and that your staff would be able to respond to those requests is really changing and elevating communication at WIC agencies. Okay, Susan, I am going to change presenters now, and I hope this works. I just want to make sure that you see the screen. Okay, I'm going to go ahead and change presenters now. And then I think you have the screen. Do you have the screen?
Yes, I do. Can you guys see my screen?
I can see your screen, and I see your slides.
Okay, perfect. Hi,
Wonderful.
everyone.
Thank you.
As Jonathan said, my name is Susan Lyles, and I am the Director of Nutrition Services in WIC for the Santa Barbara County Public Health Department. I know some of you might not be familiar with Santa Barbara County, so I just wanted to talk a little bit about us. We're located about an hour and a half to 2 hours north of Los Angeles. We cover from this map Carpinteria through up to Santa Maria. Our locations are about an hour away from each other, from Santa Barbara to Santa Maria and even to Lompoc. We also go out to New Coyoma as well. We have about 7 sites that we visit. We have a very large Hispanic and agricultural participants. 91.6% of our participants are Hispanic, and 53.2% of them choose Spanish as their primary language. As Jonathan said, 70% of Americans like to text, and we have right now about 65.7% of our participants are choosing to receive their appointments through a text message, and that has actually increased 6% from when we've started this text messaging system. Before it was only about half, and now we're jumped up to about 65. Our median age of our participants is 30 years, so we are right in the cusp of our Gen Y population, which is why we kind of went to this two-way texting system to reach all of those. Our caseload is 18,240, and on average we're seeing 93.2%. And I think that a large part of our success has to do with this communication that we've done through the two-way text messaging system, and I'm going to talk a little bit about that. So these are the 4 things that I want to touch base on today, the pros of why we've done this two-way text system. It's increasing the appointment reminders that we're being able to send. It's actually a lot easier for our WIC staff to use the system that we have, and it increases communication with participants as well as improving our phone center. So we'll go through the first one. The increased communication frequency. Our old system had just kind of a one-way street, and we were really utilizing it only for if you missed your appointment and when your appointment is. And that was kind of all we were doing it for, because we weren't getting anybody to respond to. But when we moved over to this system, we were able to immediately see when appointments were being sent out, and we could kind of adjust what we were doing for that day. And so we started finding that because people were responding more frequently to the two-way system, we started setting out more appointments. So originally we were just sending the one day before and after the appointments, but then we went to once a week we were sending no-shows for the rest of the month. So for instance, next Wednesday, which is the 8th, we're going to send you missed your appointment to everybody who's missed from June 1st to try to bring those people back in. Not only were we doing that, on this second Monday of the month, we were going to be sending messages out for all of 2 months ago. So again, on June 13th, which will be our second Monday, we're going to go through and select all the people who missed in April and send them a message that says, hi, you missed your appointment. We haven't seen you in a while. We'd like to have you come back in. We actually found that about 18% of those people were coming back to their appointments, because really with our population, it was just about that frequency of communication that was making them not come to their appointments. They just simply forgot to get a hold of us, or said they didn't want to wait on the phone center in order to make an appointment, which I'll talk about in a little bit later. As well as we found this great new way to, on the 1st of the month, we send them a reminder for the entire month You have an appointment June 16th. Also, happy birthday to so-and-so this month. And we found a lot of people responded really positively to that, so we're trying to think of other ways to acknowledge them. And that last bit about doing that birthday is really one of our retentions, to try to get these people on, to show them that, you know, we care about their child and their family. And just, we've had so many thank you for the birthday reminders. You know, they really appreciate that personalized touch that we're able to do with this two-way system that we have. And the next one is ease of our staff to use. So before we were doing this web-operated system for the two-way texting, we were just using a handheld cell phone. And we had one cell phone for our 4 main sites, and our staff were just going through that cell phone and texting with their thumbs, and it was an archaic one. It wasn't like a smartphone or anything. And so it became really a struggle for them to go through all these texts. Like I said, before we started this, we had about half of our participants wanting text messages. So it was a really big struggle for them to go through and text everybody who missed their appointment. And a lot of sites, you know, truth be told, were saying they weren't doing that. They were just trying to call these people. And what we found was they were just calling these people and nobody was picking up. But now that they're able to do it on their computers, we've chosen these super users. So users at every site that we think have the ability to easily go through texting in between seeing people when they're in the WIC office. You know, I know that for some staff it might be a struggle to find the time between people to respond to these, but we really chose those who were our super users. So you can see here's a picture of 2 of our super users on it. On the bottom screen, you can see that they have it split screen. They have, on the left side is our texting program, and on the right side is the WIC program, the WIC Miss that they're using. So they're able to toggle between the screens. It's extremely faster to respond to these messages over that cell phone that we were using, as well as to be able to have multiple users. So like I said earlier, we're sending out these key timed messages in order to get more communication and more responses. And so on those days, we might ask more of our super users to be on board so that we can respond to them quickly. Or on the days where they're slower, we might only have a couple. So we kind of fluctuate how many people we have, whereas before when we were on the phone system, there could only be 4 because we only had so many phones. But now, because we're on the web, it can be as many users as we have things coming in. Sometimes we have messages where everybody seems to respond, and there might be some phone calls going around that ask other people to step on. I did realize that I forgot to mention on the increase of users, or the increase of messages, we do send out a message that says urgent, 5 days left until the end of the month. You've missed your appointment, come in to receive your checks or call us before 4. And then we send that same message out at the last day of the month. Urgent, you've missed your appointment, it's the last day of the month to receive your checks. And those days, so many people respond. Even though they've been getting these missed messages the whole time, it's that urgent factor that gets them to really reach out to us and come back in. So that was one that that would be an example of a day where we have a lot more people, a lot more users on that day. The third thing that it really helped with is increasing the communication with participants. You know, like I've been saying, they really like to text. They are so happy. When we started it, they came in and were just like, who's the one that's texting us? Is it automated? And we're like, no, it's a real person. It's one of us. And they're like, thank you. It's so easier. You know, we have a big agricultural field. Most of our parents are working 2 jobs. They can't pick up the phone with us when we make that phone call. And we are not open on weekends, and we close at 5:30. And what we found is when we come in at 8 in the morning, we have people who've texted us at 6 in the morning or at 11 o'clock at night when they got off work. And we're able to respond to them during the working hours, and then they can respond to us, and it can be a long conversation. You know, they're okay if we send them a text at 10 and they respond to us at 11, and then we send them another one at 2. That's okay for them because they can respond on their time. They don't have to walk away from their workstation in order to pick up their phone, or, you know, they don't even have 5 minutes to really talk to us. Our staff are doing callbacks to those who've missed their appointments. And what we've done now is we've kind of limited our callbacks to only those people who said they wanted a phone call. We're really not calling those who said they wanted a text, because those are the people who weren't picking up their phone calls in the first place. They wanted a text because of the ease of communication. You know, we receive a lot of texts when our participants are running late. We've gotten ones that said, you know, I've just had my baby and I can't come to my appointment, or I got in a car accident on my way to the office, or I got a flat tire. You know, those people weren't going to sit through and call our phone center and be on hold to tell us that they got a flat tire. They just weren't going to show. And so we're able to really be there for them and send an apology when they get in a car accident, or send a congratulations when they have a baby, which adds that personal touch. But we're also able to reschedule them to a more appropriate time so they end up not showing for that month. You know, like I said earlier, the #1 reason that we see people not coming is because they simply forgot to call us or couldn't get a hold of us to reschedule. So by having this increase in communication with them, they're able to get a hold of us and make their appointments better. And the last thing that that I want to touch on today is just the improved phone center. You know, we've been able to decrease our phone calls to the phone center, as well as decrease the % of abandoned calls, and that has really helped us out in a great way. And this is a picture of one of our other super users working on the dual screen system that we've kind of created. So this first graph that I want to show you is our text compared to our phone calls. And so the yellow line is our average text messages per day, and the red line is our average phone calls per day. And now our 0 is set at baseline. So I took our average phone calls that we had before we started the texting program, and that became our 0. And obviously our average text messages before we started the program would be the first month. And we started this very slowly. We started this in July of 2015, and we brought on one of our sites. And then in August, we brought on another, September, our 3rd, and October, our 4th main site. So by October, really, where you see us jump up to 40, that's actually about 57, 60 that we have, because I averaged it as a 0. That's when we really had all 4 sites going, and you can see the huge jump in the decrease of our phone calls per day. And that has really helped us been able to give better customer service over the phone and not make that person be rushed to help the person and end the phone call. So really this has been a great help for that aspect, as well as when you have less people calling in, you're able to have less wait time. Our wait time has kind of reduced, and people who want to make that phone call instead of text are able to get that help. So really it's narrowing whether people want a phone call and want to call in, or whether people want a text message and they're getting that text message response. This last graph that I want to show you is our % of abandoned calls, and that would be the people who hang up on us, who hang up after they call the phone center because they're tired of waiting. And so you can see this red line is before we had the texting program. Again, it jumps drastically per the month depending on what's going on. And the yellow is after the texting program. January, we believe, is pretty high because we were closed for part of December. So we have a feeling that a lot of people were calling us. But this white line in here is kind of our trending line. And you can see that it's kind of trending down. It is trending down since we've had it. And we're hoping to decrease the % of our abandoned calls to really help those who want to make that call to the phone center instead of texting. So those are the 4 things that we've kind of really seen as a positive for the two-way texting. So with that, what questions do you guys have for me? And I don't see any questions or hands being raised, but I'm not really sure if I'm reading it correctly.
Hello? Hello? Hi. This is Jonathan. And questions are starting to come in now. If you have questions, go ahead and write your questions in. And then I wanted to touch on one thing really quickly. You had mentioned that clients have busy schedules and they're able to text you at various times of the day. And I think that's a really important thing. We're going to show a little demonstration of how the appointment reminders work and then how somebody can chat through text messaging in a little demonstration here after we have the questions. But it's hard to show that that is an interesting piece, because what we're talking about is the end users, how they engage with your staff throughout the day to get their need or get the issue resolved, or whatever that issue is. Can you explain a little bit how that works, just from an operational standpoint?
Sure. Yeah, and just to let you know, Jonathan, I can't see the questions that are being submitted.
I will read them to you.
Okay, that's fine. So yeah, what we've found is, we send out our text messages at about 10, because that's the time we ended up getting the most answers, because in the morning everybody's getting ready for school or work, and in the afternoon, life just happens. So we send out the messages at 10, and sometimes we get really busy at 10, and we can't respond to any until 11. And, I'll give you, so we send them out at 10, and then somebody gets on and responds to that they respond immediately sometimes. It's sent out at 10, and they respond at 10:05. And we might not get to it till 11, and we send them a message till 11, and we might reach that person only every 2 hours. But you want to know what? At the end of the day, when we've helped that person and made them an appointment, they're still sending us thank you. They're still sending us thank you, and they're still saying thank you for the great service and everything. They're really happy to just not have to pick up the phone and call. I mean, it's like Jonathan had said earlier, so many more people are wanting to just solve their issues through a text, and that's really what we found. They don't care that we're not right there immediately responding to them, because they are going through their lives. Think about when you're texting a family member or a friend trying to get a hold of them to make plans. You're not too worried if they don't text you back right away. You're just looking for an answer at some point. So I think the customer service aspect of it, of the fact that they don't have to wait on us, they're still going through their lives, and by the end of the day we've helped them, they're still really grateful that they haven't had to call into us, and they can go back and forth in this conversation to get their questions answered. Does that kind of touch on what you were talking about, Jonathan?
Yeah, thank you. And people have their day-to-day lives. I mean, they might be dealing with children in transit somewhere, or making supper for the family, or whatever. And these things, they can actually address an issue like a reschedule and still go through their day and do those things, and not have to stop everything and pick up that phone and make that call, and maybe not get through, and then leave a voicemail for you, and then you leave a voicemail for them, and it's back and forth and back and forth. And so this is really kind of allows agencies, you think, well, texting, how can it manage these kinds of communication? It's doing it, and it's doing it well, and it's doing it effectively, and it's exactly what Susan has been talking about.
I will say one thing. When we were making the phone calls, and I'm sure everybody else has been through this experience, you're making that phone call, you leave the voicemail. You missed your appointment, call us back. Next week, you're calling that person again, you're leaving that voicemail again. When we finally got a hold of those people, they were like, I've listened to your voicemail 4 times. I just haven't had the time to call you. But now that process of leaving those voicemails for that person has been eliminated, and they're much happier that they don't have all these messages that say, you've missed your appointment, can you call us back? It's one text message, and when they respond to it at their own convenience, then they don't have to listen to our voicemails again. So it's, both sides of that, going through their busy day, and they are listening to our voicemails, then they just haven't had an opportunity to respond back to it in the only way that we had before, which was a phone call.
And it's important to also stress that the appointment reminder is automated, and we're going to show that. I mean, that's an automated piece. But everything that happens after that is two-way, right? So, so the appointment reminder is the catalyst for conversations, and that's an open channel. And once you establish that the mom or the client's phone number is in the service, they can ask questions to you, and you can ask questions of them, and there's an open channel of texting that can now ensue. So it might not be an appointment reminder that turns into a live conversation. It might be something entirely different. And my benefits, am I still eligible for this or that, or do I still need to bring in this form, or whatever day-to-day needs are being met through quick two-way dialogues. We have some questions which we're going to go through, and I'm going to mention the name of the individual who is asking the question. Okay, this is from Ryan Martinic, and I hope I pronounced that right. If I didn't, I apologize. how has HIPAA affected texting options, if at all? So how are you addressing that? Now, I can also speak to the service and the important parts of that and why why we did what we did with the service. But go ahead.
Yeah, I mean, we haven't had any, the only HIPAA issue that we had to go with, most of the HIPAA issue is through Jonathan and through the web system. The only issue that we had is where to save these files to on our drives, and because we are a county, we are a public health department, so our drives were already secured, and those that had access to the drives where we were having these information that we were submitting to the texting system already had access to WIC miss. So they had access already to anybody's information. So we didn't really have a HIPAA issue on our end, and Jonathan has dealt with the website of it. So I think, Jonathan, that would be a better question. We've gone through our security issue, and nobody's ever seen any issue with it on our end. But Jonathan,
right, yep, so the website that you log into and your staff log into is an HTTPS, so secure socket according to HIPAA guidelines. So what EHRs and medical or financial institutions use to protect the data being stored, co-located servers, dedicated servers, so not in the cloud like Amazon cloud servers or anything like that. We own and operate all the servers that store the data. So it's according to the HIPAA guidelines on how all the information is stored and archived. And it's really important because it's moving that away from those like personal handsets or personal phones where it's not. You don't have. Plus, you have a complete record of all of the communications, which is also important for continued funding. I mean, you need to be able to demonstrate that these services are being rendered and these communications are occurring. And this allows you to keep faithful and complete records of all of the encounters, so that if anything ever pops up, you can pull a case and see all of the messaging that's occurred with that case, or in the aggregate. So the reporting capacity is always going to be a friend to you as you substantiate the work you're doing.
Yeah, and I guess also on our end, like our staff aren't, the system is saying, hello, so-and-so, you have an appointment with WIC at the time and the date. That we aren't giving out a location right now, and our staff aren't giving the person, when they text back, aren't giving any information to that phone number. They're just simply confirming it or changing it, and, we're not texting that phone number, the person's address, if the phone number has changed or anything like that, if that was part of your question as well.
Yes, thank you. Okay, and the next question is from Joseph Ibsen, and the question is, are you able to use your WIC auto dialer report for running the daily reminders? So yes. I assume that's, yeah, okay.
Yes, we are using the WIC auto dialer report to run our daily reminders. That's what we were doing before, and that's what we're doing now. The great thing about this two-way texting system that we have now is not only are we utilizing WIC, we are also utilizing, not only are we utilizing WIC's auto dialer, we are also utilizing the WIC's report system. And so when I was mentioning that we are doing the birthday messages, we are running a WIC's report that shows us the family name, the child's date of birth, the next appointment date, language, phone numbers, all that fun stuff. And we are screening it for those that only have an appointment and a child with a birthday in June. And, we haven't really dived into that aspect yet by using the reports, but for our messages that go out for our no-shows and our appointment reminders, we are using the WIC auto dialer, and then for that special birthday one, we're using the WIC report system.
Wonderful, thank you. And anything that any appointment reminder software that can export into XLS or CSV is going to be work with in conjunction with our system. And most are able to do that. So most services where you're scheduling the appointment are able to export into an Excel or CSV, and then it's just a simple upload You have templates that are ready-made for all of the various instances. So missed appointments, you're going to have this template go out, and your templates are according to language preference and all of that. And then for future appointments, you're going to have this template. And then the upload document then identifies what information is going to go to whom, and which template it's going to use, and then in which language. So it's really easy to do. And remember, once you get the mechanics of it worked out and the system worked out, it's just rote, it's routine, it's very easy to do. So, and we'll help. We'll help with making sure that where your appointments are generated are able to then be utilized with the system to then make all this work. Okay, so the next question is, do participants need to opt into this service? And I can explain a little bit about what that means. So opt-in. So opt-in in public health and safety is either verbal or written consent. And it can be from their mobile phone, or it can be from a system such as this with verbal consent or written consent, putting the client into the service and then sending them content, whether it be an appointment reminder or just simply putting them into the service. And the next message they get is, hi, I'm your peer counselor, and I'm going to be following up with you with such and such, or whatever the case might be. But the system allows you to have individuals opt in from their mobile phone or use the service to add their number into the system. And so you might have individuals who sign up for appointment reminders, and the next message they get is their first appointment reminder from you. And the opt-in is a verbal consent. Now, if they change their mind, and this is important, if they change their mind, they can text stop, quit, unsubscribe, and automatically, and this is according to CTI and FCC guidelines, we opt them out. So you can't keep sending them appointment reminders or text messages if, in fact, they've requested that. You'll have a complete transcript and record of what occurred, but, benefits might change. Their benefits might cancel. They might not want, to get messages from you anymore. Their life changes, or their phone number changes and they need to update. We enable quick, easy ways of updating the phone number, but those things happen. And if you're sending a message to somebody who doesn't want them, they have that right to automatically opt out, and it should be automated. You shouldn't have to go and look and see, oh, this person asked me not to text them anymore. I have to take their number and take it out of it. No, it needs to be automated, and you can run reports against it, right? You can see what clients canceled or what clients opted out. Very transparent, easy to use, and according to the guidelines, communication guidelines that are put forth through the FCC and CPIA, and are becoming much more important. Consumers want that flexibility. They want to be able to opt out and it be instant. They don't want to have to have somebody a week from now take their number from a list. I mean, it just shouldn't be that way.
From our side on that, on the WIC miss side, when they're saying their appointment reminders and they want a text, that's what we're using in order to send them that reminder. And we're not sending mass messages to people. All of our appointments are geared around, all of our messages are geared around their appointments, which fits into what Jonathan was saying about the public health and safety. We're not blasting like, it's Tuesday, happy Tuesday. We're really gearing these towards their appointments because that's what we're really focusing on here. And then as far as those who've opted out, like Jonathan said, you can run a report and you can see who said, stop, this isn't my phone number or anything like that. And we're having our staff follow up with that family to see, is there a second number that we can try? Because if we can't figure out how to get to that person, then they might have lost. So we're taking that automated system a next step to follow up with what's going on with that family and why that phone number has changed.
That's a really good point. So using the service and how it works to then make sure that you have accurate information for that mobile number is absolutely a great use of that part. So thank you. And that particular question was from Laura Tordeau, and I hope I pronounced your last name right. I apologize if I didn't. Thank you very much. Excellent question. All these questions are terrific. Okay, let me see. This next question. Did you create, this is from Joseph Ibsen, did you create a custom WIC report for your reminder text? And if everybody, it sounds like WIC is a program that is specific to California. Is it specific to California or is it across the country?
That I can't answer.
Okay.
I think it's specific to California, but I'm not sure. No,
Okay.
we did not create a WIC report for our no-shows or our future appointments. That is from AutoDialer. If you create a WIC report for it, we tried that. If you create a WIC report for it, then you actually miss the enrollments because WIC reports only capture those who are already certified in your system, and so you'll miss all the enrollment people. So that's why we're using the AutoDialer system, and we're exporting it into an Excel, which, like Jonathan said, once you get it set up, it takes 2 seconds to do it. We export the AutoDialer into an Excel to send our missed messages out and our future messages out, and then we're using a WIC report to capture the data for the date of births for our birthday message / appointment system.
Great, thank you. The next one is from Kristen Ariata, and the question is, how do you tell the clients about the option and how they opt in? So I think we covered this with the opt-in piece. Do you guys have anything to add there?
Yeah, well, when we first started it, we already had before we were using the two-way text messaging system, we had just a one-way text messaging system. So at every appointment we asked, do you still want a text or do you want a phone? So that was already in place. When we started doing the two-way text messaging system, we started advertising it a little bit more. We made a bulletin board that said you can now do two-way. We also at the same time kind of started a one-way email system. So we created a bulletin board that says, you know, you can now text us. We also changed our stamp that we were doing on our WIF folders. We talked about doing stickers, but we ultimately ended up changing our stamp. So whenever we were stamping or giving out a new WIF folder, we were stamping it Santa Barbara County WIC program, our phone number, and our texting system with our code. We were putting stickers on for a while before they needed a new stamp. So that's one way that we were kind of doing it. But really, it was word of mouth. What we also noticed was that when we first started sending out these messages, because we only had a one-way system, people were hesitant to respond. They come in and they'd say, you know, I saw that it says that I can respond. Can I respond? And we'd be like, yes, you can respond to us. And once people started to respond, then they felt more comfortable responding over and over again. You can tell at the end of the month, you know, as Jonathan said, you can see all these conversations. It's the people who've missed the 2nd day of the month and the 14th day of the month and the 25th day of the month. They're the ones that are always messaging us because they know they can get through. It's just kind of, you know, everything with us is just kind of word of mouth. And once they felt comfortable with it and once they knew they were going to be responded to, then they started utilizing it more and more. Now we have people who are sending us messages, you know, I have an appointment next month that I need to reschedule. So it's really just the comfortability that they felt with the fact that it was going somewhere and it was going to be responded to that kind of grew our program to what it is.
Wonderful, and thank you so much. What a detailed response, and what attentive participants. Just wonderful, right-on questions, and I really appreciate these questions. The next question is from Elsa Quintana, and the question is, do you have peer counselors utilizing the tech service to communicate with clients? If so, do they use their own mobile devices, or do you provide one? How do you track discussions? And I may have to help a little bit, but let me know. I can jump in at any time if you want.
Sure. So our peer counselors are actually using the system as well. They're not on this exact. We have 2 systems. We have the breastfeeding peer counselor one, which is the automatic timed appointments for when their due date is. And then we have a system that's for just the WIC appointments. So yes, they have their own system. It's very similar. It's set up by, you know, Jonathan as well, but it's not this appointment one that I'm talking about today. And they don't have their own mobile device because it's web-based. So they have their own computer. I mean, on Tuesday when I was sick at home, I was able to even send out the reminders from home because it's just web-based. And so they're not utilizing a mobile device. they're utilizing their own computers or their laptops because it's via web. I'm just not sure if that answers the question. If you think you want to add more, Jonathan, feel free to.
Sure. So, and thank you. Yeah, so GenY by two systems, what it is just a couple of inboxes. The mechanics of it are the same, but they're handling all of their appointment reminder traffic through one place, and of course staff are logging in and totally different from the peer counselor work. Peer counselor work is happening in another inbox, and all of the peer counselors are logging in and responding to their clients' needs through a queue in that inbox. And that is an incredibly powerful component of the work Santa Barbara County has been doing. It's migrated away from the mobile phone so that peer counselors are doing their work at regular hours of operation, and they're doing it at scale, so they're able to communicate rather rapidly because they're on a computer workstation, and then they're able to also ensure that all of those conversations are being stored and are available, and the educational messages are going out, and they're able to check that and see and verify all of the things that Susan has been talking about being the benefits of being able to text with individuals about things is part of that program. And recently at National WIC Conference, another agency using the peer counselor service shared from Colorado about this very thing. It's just really changed. Retention rates are up. They were experiencing tremendous declines. Okay, they were losing funding was really being strained, and they were losing a lot of funding, and they needed something to really jar it, to make a change, to make a shift. And they found that text messaging is actually helping to keep clients engaged and active with their benefits, and client retention rates are up. So there's a tremendous upside, not just of providing communication in the medium that they want to be using, but also in that long play that ultimately this is going to impact our funding, because if we can keep more clients engaged and keep more clients active, then we're doing our job to increase retention. And we're actually seeing other agencies that are providing outreach, so they provide notice that you can text in and get information about WIC. Maybe have it be completely automated, where they get a bounce back message or a Q&A that's automated, but it's like flypaper. It's attracting individuals who would be potentially qualified for WIC to learn more about it, because it's reaching them through that medium that's so powerful. If I can just text and check to see if I'm eligible, answer a couple quick text messages, that's really going to change also and impact enrollments. The next question. Okay, is it an opt-in service, or can we create text groups and lists regardless of their text carrier? All carriers, and that's one of the reasons why we utilize the service and set it up the way it is. We provision what are called short codes, 5 or 6 digit numbers. In the case of Santa Barbara, they're using a short code 85511 for their appointment reminders. And so individuals opt in and they get text messages from that short code. The short code allows us to ensure that you can communicate with all clients across all carriers. So is it an opt-in service? It's an opt-in that's verbal or written, and once they're in the system, you've got an open channel with them. They're always going to be getting text from that same 5 or 6 digit number. You can, if you're in a conversation with them, you can populate your text with your name if you're a peer counselor, things like that, so that it's very personal. But the communication that they're getting is going to be from that short code. And short codes are the only numbers that allow for automated opt-in, opt-out, because they're provisioned with the carriers. All the carriers are in tow. And we incorporate also message tracking and delivery receipts, so that if somebody says, I didn't get a text from you, you said you were going to remind me of my appointment. You can actually pull up that phone number and you can see that that message was delivered, and the carrier is acknowledging it. So it's the carrier that's saying that that message was delivered. So you can go back to the client and say, look, we need to troubleshoot. We need to figure out, how do we have the right number for you? And that's all because of the way the service is set up. You can use the service as a check and balance as a quality assurance. Okay, what happens to text that, and this is from Aaron Garcia, what happens to text when you receive them after hours or when you're closed?
They just sit there. Jonathan will show you an example, a demo later, but they just sit there. It's like your inbox and your email. They just sit there unopened until we come into work the next day. If we are closed for holidays, then we do have an automated response that says we're closed for holidays, or we'll be back, on this date. But during the weekends, we just kind of have it sit there, or after hours, it just sits there too. And when we come in at 8, then somebody responds to it. I also just realized that here's my information. I'm just going to change the slide to my information. So in case you guys have additional questions later on, you can just feel free to call or email me. But as far as the messages that are sent when we aren't in working hours, nobody seems to be upset that they texted us at 11 p.m. and we didn't respond till 8 a.m. I think they kind of understand that we're closed.
And you can have messages that go out automated for your after hours. Some agencies, they want to do that. They want to let people know that these are our hours of operation. We'll either text you back, or you can text back during those hours of operation. But then the client and the request and the message will be in the queue, very transparent. You can see there that they texted after hours. But what you send them is up to you. What you send them during those after hours up to you. But there are tools available to automatically send back a message for specific hours of the day. Okay, there are several more questions. We got to several real quickly. This one, have you collected feedback from clients about text messaging via survey or in a larger way rather than individual feedback? So have you collected anything, I guess, in relationship to the receiving of text messages, I guess?
No, we haven't done it on we did it before we started the system, which is how we knew that lots of people wanted a two-way system. We haven't had the system for a year, so we do plan on kind of reaching out and asking people their satisfaction with it in terms of their time response or anything like that. Again, we just got all 4 sites up and running as of October last year, so we're kind of giving it some time to do it. But as far as, we've jumped 6% in our participants that now want a text message. So to me, that kind of speaks volumes that word has kind of gone out and this is how they want to communicate. I think that if it wasn't successful, people would have now said, I'm tired of getting text messages, or I don't want to do that. And we would have seen more calls go to the phone center instead of away from the phone center. So I think that that data is kind of speaking. And now I think, after we reach our year mark, we'll kind of look about, are we responding fast enough? Are we giving them the right information? Those types of things. But I think it's working. We'll just start to do a survey of it. Sorry, that was a long response, but in answer to yours, no, we haven't done a survey, but we are looking at the data as far as what they are responding to, texts, or how much they're responding or calling us.
Great. And we have agencies that are using this appointment reminders in very large ways, where they've got several staff responding to the queue at one time. So it just depends on how how much traffic you're handling, and but the idea that you can handle a lot of communication at one time is going to be, a huge benefit to this. So handling traffic at scale, or handling requests for help or at scale. So Susan talked about super users, so people being able to respond to a couple or a few client requests concurrently. So being open on a few different cases, kind of like how you respond to email. You'll respond to several emails throughout the day, and then as those issues are resolved, those get archived in your email inbox. Text messaging system works the same way. It can be responding to several individual requests ongoing throughout the day, and then as you resolve those, you close them out, and they are archived in the queue. So we're going to shift gears. Thank you so much, Susan, for your support and your share. It's so informative. I'm going to quickly show a demonstration of the appointment reminder tools as we discussed in this presentation. So bear with me. What we're looking at here is an Excel spreadsheet. Now this Excel spreadsheet can have columns of information here that what we refer to as dynamic substitution. So these are the columns that we're substituting into the appointment reminders. Now the Excel spreadsheet or the export from your appointment software will be something akin to this. If it isn't, we can help you develop macros, XLS macros, to clean it up, to prepare it then for upload. So there's, but this is the beginning place where the appointment reminders are going to start. And then over here, under the admin tools, I have appointment text. So these are all my templates that I can create, right? I can have several templates for all of the different scenarios that we talked about. People who miss their appointment, people who need to be reminded of future appointments. So these would be where you would keep track of all of those templates, all of those possible appointment reminder messages. They're going to now be automated. Once you have all your templates set up, then it's just picking which one's going to apply to the document or the appointment reminders that you're uploading. Now, going over here, I'm going to demonstrate how I'm going to upload the Excel spreadsheet. So I go over here to the Appointments tab, and I browse and find that particular file that I was working in. It's my Excel spreadsheet that I'm going to upload. So then I pick that, and I select the keyword that I'm associating to this. This helps keep track of the appointment reminder in the system or the type of appointment reminder in the system. And then I import, and I get a preview of everything, all of the appointments that are going to be sent out. What language, who they're going to, the date and time of the appointment. So I get a preview of all of that so that I can make sure that the information that's going to be going out is accurate. You might have hundreds or thousands of appointments here, so you may not be able to go through all of them, but it gives you a snapshot of, or gives you the details of what you're about to do. And then I just pick the appointment reminder that I'm going to use. So I want to substitute the name. I want it to be personal. And then I'm going to tell them this is a reminder for their appointment, the date and time and the location. These columns, though, could be any substitutions that you have. So again, we're substituting from those columns. It could be a particular individual that they're meeting with that's a substitution. Now, the important bit to notice about all of these is that we're asking them to text back if they need more help or assistance with this information. That's the key. Once I'm satisfied with what I pick, I then go ahead and send my appointment reminders. They go out, I get a report. The two individuals that I had, my colleague, myself, phone numbers, we both got our appointment reminders, and I can look here and I can get information on how many appointment reminders I've sent. If any appointment reminders are unsent, they would appear here along with the phone number. I can go to the Reports tab, and I can run a report for my appointment reminders. So just looking at the specific details of all of the appointment reminders that I sent. Were they successful? What message was sent? To whom? All of the columns and the details will be in that report. So tremendous capacity when it comes to reporting and surveillance of the activities that are happening. Now, we go back here to the Users tab. The Users tab is where my inbox is. Okay, so if a client needs to reschedule, or if a client has a problem with that with their appointment, all they need to do is, of course, text back as we've invited them to. Now, you may not have that capacity. You may be telling them they need to call you. But the point is that you're using text to get that appointment reminder to them, and then you're asking them to text back or call you to reschedule. And in the model that Susan talked about, the text back is a tremendously effective way, because it's keeping with the medium that they're preferring. It's keeping with that medium. So if I want to reschedule, I would just text back. I'm on my phone, of course, and I say, I'm sorry, I can't make that appointment. And I'm going to send that. So I've got an audio alert here, and this is where the staff come into play, right? This is where individuals who are, in the case what Susan was talking about, super users, people who are on the phone and then also potentially responding to requests for help through the text messaging service. But it will update you, just like when you get a new email. You know, okay, here's a new email, and it pops to the top of the queue. And I can click on the phone number, and I can see what happened. I can see what transpired. That they got an appointment. I can look over here, and I can see the exact appointment that they got, June 2nd. And then this is where all the conversation happens. I'm sorry, I can't make that appointment. So how do I converse with this client? All I need to do is click the open button. And now I've got a text box, and I can begin to have a live conversation with this individual. I also have over here canned message libraries. And canned message libraries can be customized right down to a general canned message library that would be, and when I say canned message, I just mean messages that are going to help you quickly converse with clients, get through appointments fast, or get through reschedules fast. Your canned message libraries can be customized, and you can have various libraries depending on the issue or depending on the responder. So a particular staff member could potentially would be able to have their own personal library, so they could put names in those canned messages, so that it's always with that personal touch, right? Susan talked about that. Well, gosh, we love these messages. Are they coming from a machine? Are they coming from a computer? And so and then she said, no, we're texting you those. So that's, people are used to getting automated text messages from government agencies. And so it takes a little bit of conditioning, or it takes a little warming up to find out then that there's actually, these messages are coming from an individual. The canned messages help you to get through them quickly. So reschedule appointments. See, I've got all these different missed appointments. The ones that are just going to be mine, that I'm using, that nobody else would use. I could be looking at the missed appointment scan library, or the reschedule appointments, which I want to be looking at. So then I just select the message that I want to use, and I click send. And that then updates down here. I've got that message on my phone. Hi, sure, what's better, mornings or afternoons? Now, you see here, I'm engaged with a staff member who's responding. Somebody else couldn't doubly respond to this while I'm responding. I'm in a live conversation with this individual in progress, and I've started the conversation. And now it's just a back and forth two-way dialogue until we get that rescheduled, that appointment rescheduled. And then the next message they're getting from us is their appointment reminder. So you can see there how an automated message that's being sent by the system through the protocols that we talked about turns then into a request for a reschedule and a request for live help. Simple as that. The tools that you use are all available to you through this user interface here. If you have any questions about how the service works, I'm going to jump back over to, hopefully here, and jump back over to this slide here. If you have any questions about this service, please email us. And this is, we put up those we put up the slide with Susan's contact details. If you have any questions about her protocols and how she set up the service for her agency, I urge you to reach out to her and ask those questions directly to her. If you have questions about the service, specifically about how it could work for your agency, you can email info@preventionpaystext.com, and also visit us on our website. We're at preventionpaystext.com. You can also phone us. Here's our phone number here. Like I said, if you have any questions whatsoever about how the system works, please feel free to reach out and ask those questions. We can also set up a demonstration for your agency where you can really look to see how texting can help your agency. Because you might be coming up with ideas just based on this presentation today. You might be thinking, well, gosh, we could use it for this, 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 and this. And so coming to us and asking about that, we encourage you to do so that if you do choose to use a service for texting in your community, that we're maximizing its efficiency and its effectiveness. Right? We're finding all the ways it's going to help you. Are we going to provide outreach? Are we going to help with the appointment reminders? Are we going to help with the peer counselor work? Just day-to-day texting communications. Where is it? How is the service going to be used with your agency? And once we determine that, then the setup and training takes about a week, and you guys are off and ready to go. And we've set up statewide agencies with live two-way communication. We've also done, of course, rural work, smaller agencies. We have rates and packages that are based upon if you have a low caseload, we offer reduced rates, but extremely affordable packages that we provide. So reach out, and we're very transparent about all of that. If you have any questions about cost and then express uses, go ahead and email us. All right. Thank you so much for your time. We provided you with a download or a PDF document of the particular article in the National Lactation Consultants Journal, and you can download that. Then also